Enti yefa sasem no si hana yenko ensem foforo so. Kane mampani John Dramani Mahama so na ka kire enei mampani Adodanko Akufo-Addo se wajeja ne ho. Covid no ho brank asese wobo no waye loose. Enti na amasese asetra na etretra Ghana enipa dodo a enya bi no akwakodu saa empempenso yi.
I wish to emphasize that the present situation we are grappling with could have been avoided if suggestions offered by well-meaning Ghanaians, including myself, were heeded by government. The Akufo-Addo administration refused to listen to calls to include assembly members and traditional leaders in public education about the disease, in distribution of COVID relief items, and in contact tracing and surveillance. The result has been the disorderly and chaotic distribution of food that caused the lifting of the lockdown. Public education has also been abysmal, and understanding of the transmission of the virus is low. Messages in our major local languages are very few or non-existent in many cases. This is reflected in the total absence of physical distancing in our public places, such as our markets and transport terminals. Involvement of traditional rulers in guiding surveillance and contact tracing would have delivered positive outcomes because they know their communities well. The consequence of government's decisions born out of short-term political considerations instead of the science of the pandemic has been the rising number of COVID-19 infections and the resultant deaths we're seeing today. From 2 confirmed cases on March 12, that rose quickly to 8,548 on 1st June. Today, 17 days later, we have 12,590 confirmed cases and 66 deaths. Reports that isolation and treatment centers are full make the situation all the more dire. While government keeps priding itself with success in testing and has attributed the high rate of infection to the increasing number of tests being conducted, many have expressed skepticism about the accuracy of government's COVID statistics and gone as far as accusing the authorities of massaging the figures.